Hi everybody, my name is Charlie Cole. I work for Allegiance Hospice, and my informative speech is about Allegiance Hospice and what we do and how we benefit to our community and how we help our community. Before I get going, I would like, if there's anybody in the room, ask them a question. Has anybody ever had experience with hospice or with our hospice or any other sort of hospice? Nobody? Okay. Well, I'm going to go through, I have a little presentation here, and I'm going to go through this presentation and kind of explain what we do. Slide, please. First of all, you have to know the diseases and conditions experienced by hospice patients. Cancer diagnoses, debility, failure to thrive, which pretty much means people can't take care of themselves anymore. They aren't able to walk. They pretty much aren't able to care for themselves. HIV and AIDS, multiple sclerosis, ALS, Huntington's, congestive heart failure, cardiac diseases, lung diseases, and Alzheimer's and dementia. All these are hospice, pretty much general hospice diagnoses. Our criteria for hospice, people pretty much have 6 months or less to live. Slide, please. A way we keep our patients safe from germs and spreading some of these diseases is infection control practices. First one would be universal precautions, which is like gloves, gowns, masks, goggles, hair nets, shoe covers. As employees, we get TB tested every year. It's required. Like I said, personal protective equipment is like the gloves and the gowns and stuff. And policy and procedure, we have certain guidelines we're supposed to follow of how we remove and put on our protective equipment. And it's very important because if we don't do this correctly, we can get a lot of people sick. Slide, please. Pain and symptom management. Ways we can help manage pain with our hospice patients is back and hands and feet rub. Relaxation, try to make our people feel comfortable. Certain kinds of music, cultural music, what they grew up with, stuff that relates to them. Other alternative treatments, like giving somebody a nice hot bath or a jacuzzi tub or a hot shower or anything to make somebody feel comfortable. Certain pain medicines that help take away pain are very crucial into what we do. Go on and hit another slide, please. We have volunteers here at hospice, and volunteers is very, very important because our volunteers are usually retired folks that come in and they go and sit with patients and keep them company, talk to them, give them emotional, spiritual support, things like that. Hospice guidelines for hands-on care by volunteers. Non-skilled care comfort measures, nonverbal signs of pain or discomfort, and signs of approaching death. All these are guidelines for what the volunteer needs to know, before getting into this racket. It's very, very crucial to not go in there blind. Kind of know what you're getting yourself into. Because yes, every patient we take care of is dying. Next slide, please. Next slide. Interdisciplinary team ethics and hospice care. Team functions and responsibilities. The interdisciplinary team IDT approach to hospice care. And what that is, our IDT is informational data transcripting. And what it is every Wednesday, all the nurses and doctors of the hospice team, we meet actually in this conference room, and we talk about every hospice patient that we got, their diagnoses, what type of medicines they're on, if they have skin breakdown, if we're treating, what kind of treatments we're using. It's just pretty much a big information sharing program. And it's all, everything's tied into one. It's all computer based. Everybody gets on their IDT and it's all on the computer, and we all sit down and have a meeting and discuss everything. Palliative care emphasis, Palliative care is pretty much the patient is dying. Like, it's called actively dying, which means they generally have 72 hours or less. Ethics in hospice care, importance of confidentiality and documentation. It is very important that we keep very good documentation because it helps us cover our own tails. You understand what I'm saying? We pretty much document what we do, what kind of treatments we use, what kind of approach we're going to take, what the doctors prescribe. You know, certain things like just like normal medical documentation, but it's hospice documentation. Next slide, please. The interdisciplinary team approach to hospice care. How does the hospice team approach care using IDT? Like I said, we all meet every Wednesday. The patient and family involvement, this is very important because if you don't have the patient and the family on board, then what the heck are we doing here? It's very crucial because we don't, Allegiance Hospice, we don't come in and do all the care. We are a support system. We come in and support the families. We teach, we educate, we show what's got to be done. You know, we're also a teaching organization to the families to care for their loved ones properly. We also have pastoral care and bereavement services. It's integral parts of hospice. Pastoral care is like spiritual care, religion, stuff like that. Bereavement is usually for the families after the hospice patient passes on. You know, we send out a packet and a bereavement coordinator goes out and helps people deal with the loss of their loved ones. Next slide, please. Palliative care emphasis. What is palliative care? Like I said, it's the difference between hospice care and palliative care. Hospice care is 6 months or less. Palliative care is you're on your deathbed and you got 72 hours or less. How does it coordinate with hospice care? Good question. Hospice care is pretty much keeping people comfortable as they get to the palliative care stage. We keep them comfortable, we keep them properly medicated, you know, we keep the families comfortable and enjoying their last days with their loved ones. And we come into the palliative care, and like I said, it's like 72 hours or less, and you know, people usually pass on. Next slide, please. Ethics in hospice care. The National Hospice and Palliative Care Organizations offers a code of ethics with 4 main precepts that directly concern hospice services. We meet the needs of the patients. We act honestly, truthfully, and fairly. So we run on an honor system here with Allegiance Hospice. We instruct communities about the hospice and palliative care philosophy. We strive for the highest level of skill and expertise of the staff and volunteers in the delivery of care. We strive to be the best of the best of the best. Next slide, please. The importance of confidentiality and the documentation. Confidentiality agreement is an agreement that we sign that we won't violate HIPAA, and HIPAA is a law that you can't, you know, say you got Bob here, he's got pancreatic cancer. I can't go to Bob's neighbor and say, hey, Bob's got pancreatic cancer. That's not his neighbor's business. That'd be violating HIPAA, and I would lose my job. Patient's Bill of Rights and required documentation. Next slide, please. Overview of hospice services. The birth of hospice. Concept from medieval times as a place for refuge for the sick and the dying. The root word from hospitality, sense of protection, refreshment, and fellowship. The first hospice founded in Dublin, late 19th century. The first hospice in the United States was the early 1970s. Initially, as a voluntary organization, where just people didn't get paid for it, the volunteers would just come in and dedicate their time to these sick and dying people. In 1982, Congress creates Medicare reimbursement, where they turned it into an actual service. It's now, in 1982, it's now recognized as a health practice. Next slide, please. The history of Allegiance Hospice goes as following. 1981, volunteer-based hospice started by 2 nurses. 1982, became a United Way agency. 1987, certified by Medicare and Medicaid. 1998, affiliation with Foot Health System. 1999, relationship with Oak Lawn Hospital to serve patients and families in Calhoun County. 2001, operational integration into Foot Home Health and Hospice Services. In 2008, it was a name change from Foot to Allegiance. Slide, please. Our mission statement here at Allegiance Hospice is provide quality health care to the terminally ill and support to their families in Jackson and the surrounding areas. Slide, please. Our hospice philosophy. Hospice believes that people have the right to die in the setting of their choice and to be as comfortable as possible. Hospice believes that palliative care is the approach when treatment of patient's disease becomes ineffective and irrelevant. Slide, please. Settings, hospice settings, where us as the hospice team, our direct care, we go into all sorts of settings. We go into people's homes. We go into adult foster care. We go into nursing homes. We go into assisted livings, homes for the aged, and we even do GIP patients up at the hospital. So we go in all sorts of different settings. And from my experience, every setting is different. Slide, please. Reimbursement. We, Allegiance Hospice, are a non-profit organization, which we don't thrive to turn a profit like Great Lakes or Southern Care. They're for profit. We're non-profit, which means we don't, like I said, we don't thrive to make money. But we get reimbursed to keep our wheels turning through Medicare, Medicaid, Blue Cross Blue Shield, commercial insurance, private pay, and charity cases. Charity cases is cases that we pretty much do for free for people who don't have insurance, who can't afford anything. Private pay is where people pay right out of their pocket. There you go. They don't have any insurance, they just pay everything in cash. Next slide, please. We have a hospice home over on Springport Road, the most beautiful place I've ever been in. Opened in May 2007 and began training staff. It admitted our first patient 7 of 2007. It's a 20-bed facility, all private rooms. It's licensed as a hospice and a nursing home. And it provides care to those hospice patients that can no longer remain at their home due to their illness. Next slide, please. Like I said, not-for-profit and fundraising. Allegiance Hospice is a not-for-profit organization, like I said. We rely on donations raised throughout fundraising events to help out with operational costs and for our charity cases. And like I said, charity cases are the people that are, the indigent people who are broke and they have no other way to pay. And, if you ask me, I think that's wonderful. Next slide, please. Sorts of fundraising that we have. Fundraising is utilized to offset costs. It's available for charity care cases. Hearts for Hospice we have in the spring. Bake sales throughout the year. Hospice 5K walk and run, which I personally did and it kicked my butt. Helping Hospice golf benefit in the fall. Bowling event, which is in the summer, and the holiday giving tree, which is in the winter. And I really like the holiday giving trees because we're just bringing all sorts of canned goods, non-perishable items, and we make boxes and we give them to the less fortunate in our community. It's a real good program we got going on. Next slide, please. Like I said, volunteers, the types of volunteers we have, patient care volunteers, pretty much go and sit with the patients, and like I said, they help them spiritually, they help them emotionally, sometimes they even help them physically, like getting on and off the toilet or stuff like that. Bereavement facilitators, they help the families with the grieving process of losing a loved one. Office support, we have volunteers that work up here in the office that do our filing. They do, they help with paperwork. They help with, there's some volunteers that, run and do this and run and do that, and we just would not function if we did not have volunteers. and fundraising events. A lot of volunteers help out with fundraising events to help make money for all the stuff, all the stuff that we do. Next slide, please. Volunteer contribution. Federal law requires that 5% of patient care hours must be provided by volunteers. Volunteer contributions are invaluable to the organization, being that we are not for-profit organization, which pretty much means it really helps us out that we don't have to pay them because we would pretty much run out of money. Volunteers contribute to our sense of community within the hospice. Like I said, without volunteers, we would not function correctly. Next slide, please. Volunteers are important members of patients' care by helping to deinstitutionalize the dying experience and provide a more humane system of care for the dying and their families. Volunteers in hospice find their work to be personally rewarding, intellectually stimulating, and emotionally meaningful to assist those in need. Slide, please. And that's the end of my PowerPoint. So overall, I've explained how hospice works, where our money comes from, how our staff works, how our information gathering about the patients and IDT. I hope you all enjoyed this, and I would just like to thank you all for your time and appreciate you all being here.